Hello, my name is Amanda Turner. This term, I completed my senior practicum on breastfeeding, and I'm excited to share my experience and outcomes with you all. My current unit is a 28-bed pediatric medical surgical unit. A good portion of our unit's population consists of infants who are admitted for issues like failure to thrive, jaundice, dehydration, feeding intolerances, and other issues that may affect feeding. These issues can be related to or caused by breastfeeding difficulties. As a pediatric nurse, it's my job to be informed on breastfeeding and support it because of its health benefits. A few of these benefits include reducing the risk of SIDS, reducing the risk of developing type 1 diabetes, and asthma. Oftentimes, night shift and weekend shift nurses don't have consistent access to the lactation team due to their normal business hours schedule. So, due to the benefits and the issues with lactation support and the patient population, I designed my in-service for the night and weekend shift staff to educate them on breastfeeding basics to better serve our patients and their families. My objectives for my project included gathering information, implementing an in-service, and evaluating the effectiveness of that in-service. First, I gathered information on proper breastfeeding latch and different positions from 7 different peer-reviewed articles, MUSC's breastfeeding policy, and other evidence-based literature. I used this information to create a slideshow, a quiz, handouts, and demonstration and problem-solving scenarios. And then finally, I evaluated that effectiveness of my in-service by assessing how the participants answered these questions and scenarios and grading their post-in-service quiz. So overall, my goal was to educate my coworkers on breastfeeding and give them the tools needed to help educate patients' mothers. The skills needed to conduct this in-service included organization skills, time management, strong public speaking, and verbal and visual demonstration skills. I presented my presentation about breast milk storage guidelines with appropriate timeframes, nursing positions such as the cradle, football, and reclining, and key factors to identifying proper latch, such as the angle of the infant's mouth and their head and shoulder position. During my in-service training, I had the participants follow along with the slides while using a baby doll to mimic the positions. I used this technique because I reviewed a study published in 2021 that reported the most common preferred learning styles were kinesthetic and visual. By conducting my in-service using a baby doll demonstration and my PowerPoint presentation, I was able to cater to the 2 most common learning styles. So on the left, you will see the MUSC baby-friendly policy, which states that MUSC does not accept free gifts or supplies of breast milk substitutes and promotes successful breastfeeding. This policy, along with peer-reviewed articles, were the foundation to my practicum. I researched literature about breastfeeding and learning styles because I wanted to not only obtain the knowledge about breastfeeding, but also be able to teach that information in a way that would be retained by the learners. I then created an in-service training material, which included a lesson plan, handouts, and the post-service quiz that's on the right. I created this quiz to contain multiple choice, true and false, and select all that apply questions. So my examples of evidence includes these handouts that were distributed during my in-service training to provide visual aid to the participants. On the left, you'll see the outline of the 6 key factors as described by WIC breastfeeding support to identifying proper latch. The handout on the right outlines 3 different breastfeeding positions that I reviewed during my in-service training. The cradle position, the football position, and the reclining position were the three that I chose to focus on for my in-service because of the problems they solve. The cradle position is the most common go-to position and is ideal for everyday on-the-go life, while the football and the reclining position are for mothers who may be breastfeeding multiple babies or have had C-sections. I wanted to be sure to include descriptions in these handouts with pictures as well for staff members to be able to reference later if needed. Specific outcomes for the 8 acute care unit included the staff members reporting an increase in breastfeeding knowledge following the in-service training. All staff members reported an increased confidence to assist a mother with basic breastfeeding needs. Staff members were able to identify different breastfeeding positions that may be helpful to twin mothers and mothers who have recently had a C-section, and 4 out of 5 staff members received 100 on their post in-service quiz. I would like to point out the importance of the third outcome. Due to MUSC's high-risk demographic, we see a lot of mothers who have twins or triplets or C-sections. And according to the Mayo Clinic, the football hold is the most helpful for mothers who have had a C-section or multiple babies because it allows for the infants to breastfeed and not be on the mother's incision or to breastfeed multiple babies at once. And based on these outcomes, I feel that my senior practicum was a success and that the 8 acute care staff is well equipped to help mothers with their breastfeeding needs. Ways that I will apply this project in practice and education: I will integrate breastfeeding evidence-based practice into patient care. The information I learned from the articles and references will be used in practice and to educate patients and other staff members. I'll be able to assist future unit training programs. Um, this project has helped me prepare to take on more education roles within my unit by researching different learning styles and how to conduct training activities. And finally, creating learning material. I will be able to apply this knowledge on designing handouts and material and future unit education opportunities. The value of this project for my lifelong learning has been this project has strengthened my ability to adapt and solve problems. It has strengthened my clinical breastfeeding competency, my teaching abilities, and my evidence-based practice integration. As nurses, we are responsible and held accountable by governing bodies and our patients to be lifelong learners. Being lifelong learners allows us to update our practice and enhance our educating abilities. These are important attributes for nurses to have, in my opinion. These are my references. Thank you for watching, and I hope you enjoyed learning about my senior practicum.